The esophageal cancers are now growing up in India. Most important is that the esophageal cancers have poor prognosis. The 5-year survival rate of the symptomatic or advanced stage esophageal cancer has only survival rate is only less than 20%.
Hello and warm welcome to MedSynapse channel where we bring you insightful conversation with leading experts in medical field. Hi, I'm your host Dr. Smarika Bhatt and today we'll be introducing you to with Dr. Abhijit Powar who isn't just another medical professional. He's a distinguished gastroenterologist and oncology expert. He's the chief consultant at Saraswati Surgical Hospital in Kolhapur. He brings a wealth of experience and insights that could be a game changers to our listeners. Dr. Abhijit Powar, welcome to the MedSynapse community.
Hello, thank you, Smarika. Thank you for a kind introduction.
Without further ado, we'll start with our first question for the podcast interview is how exactly do you detect high-grade dysplasia? And more importantly, how confident can we be in these early detection methods?
Actually, high-grade dysplasia patients are going to be asymptomatic in most of the times. So we have to undergo the gastroscopy procedure to diagnose the high-grade dysplasia. While doing the procedure, we look for the abnormal lesion in the esophagus. Then we, with the help of advanced endoscope, we magnify and by using the NBI technology such as narrowband imaging technology in certain kinds of scope, we can focus, magnify and then localize the lesion. If on NBI you are not going to sure about the precise location of the high grade dysplasia, then we use another methods called chromoendoscopy with the help of Lugol's iodine. In that Lugol's iodine, if the certain kinds of dysplastic cells are there, then malignant cells are not going to take the Lugol's iodine. There is a no uptake of the Lugol's iodine in that malignant cells, so they are going to be highlighted in endoscopy, and we precisely precisely locate that lesion and take biopsy, and will confirm on basis of biopsy only.
Okay, Dr. Powar. So that was very insightful. So moving on to the next question, why do we focus more on early detection of esophageal cancer? Is there any dire need of it?
Okay, actually, this is a very alarming question in current scenario, because the esophageal cancers are now growing up in India, and in Western there are lots of cases are going to be detected in earlier days. But most important is that the esophageal cancers have poor prognosis. The 5-year survival rate of the symptomatic or advanced stage esophageal cancer has only survival rate is only less than 20%. So early diagnosis is key. If these cancers are going to be detected earlier, such as high-grade dysplasia or carcinomas in situ, then prognosis survival rate is going to be more than 85%. So there is much margin is there for the survival if you are going to detect these lesions earlier. And esophageal cancer is an aggressive disease. So due to the biological nature and rich lymphatics around the esophagus, which makes them earlier to spread and have the metastatic potential. So based on these findings, I think it is very important to diagnose these cancers earlier, and we can diagnose it if we are sufficiently trained. There is a lot of learning curve in diagnosing this lesion, but surely we can diagnose, and we can reduce the mortality, and we can diagnose the patient earlier and treat them also earlier without any morbid procedures such as thoracotomy, and certain radiation or chemotherapy may not be needed in earlier if the patient is diagnosed earlier. So it is the dire need of current scenario.
Thank you so much, Dr. Pawar, for covering the procedures as well for early esophageal cancer. So now can you help us understand the audience, what is the symptom of early esophageal cancer?
Actually, the advanced stage, most of the times the cancer is going to be symptomatic only when there is more than 3/4 compromise of the luminal knurring of the esophagus. Then only the patient is going to be present to us. In early esophageal cancers, most of the times there is no symptom. The patient is asymptomatic. And if some of the patients may have burning sensation, indigestion, painful swallowing, and difficulty in swallowing, weight loss is not commonly observed in early esophageal cancer. Reduced appetite, persistent hiccups, and chronic cough may some of the symptoms may be seen in the early esophageal cancer, but actually I am a little bit more focusing on the asymptomatic stage, because early esophageal cancers are mostly asymptomatic. So we have to go and search for that.
That was a very well put together answer. So we'll move on to the next question, especially the diagnosis part. So what definitive role does PET-CT or EUS plays in the diagnosis of early esophageal cancer?
Actually, Smarika, we going to discuss the each modality differently. In PET-CT, we going to take the fluorodeoxy glucose images, and along with that, we superimpose the CT scan with that modality, and we going to diagnose the cancers in various cancers in this FDG PET-CT. But in early esophageal cancers, chances of lymph node metastasis are very less. So uptake will be not going to be detected in the FDG PET. Also, the early esophageal cancers are mostly localized to the esophageal walls. So in that esophageal wall, the fluorodeoxy glucose uptake is also very less. So FDG PET is basically it is for the advanced stage cancers only. When there is a metastasis, the FDG PET has a good result in diagnosing. And actually, when it is developed for the management, this investigation is primarily used for the post radiation or post chemotherapy to see the response to the what we are going the which modality we are going to use, and based on that whether it is responsive or not responsive. In that case scenario, the FDG PET is going to be very much helpful. In these cases, it is not much useful. We are going to discuss regarding the US. US is the endoscopic ultrasound, where we put the specifically designed scope into the esophagus, and we screen the patient for the to what extent the malignancy has spreaded to the wall of the esophagus. Is there any lymph node metastasis is there? But in US, the actually some of the meta-analysis or some randomized control studies are done outside the India, where they have seen that US is going to be overstage or understage the disease. So it is not useful in early esophageal cancers.
Thank you so much for sharing your insights with us, Tiz. It was a lovely conversation and you sharing your insights about early esophageal cancer. Thank you so much for joining us today.
Thank you.
And thank you to our viewers for tuning in. And remember, if you are a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate us to join on MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers or participate in meaningful discussion and contribute to the ongoing evolution of healthcare. So until next time, take care.